Brian Shelton. I'm a functional medicine doctor with mygotodoc. I'm happy to be back again this week and teach you hopefully something a little more about functional medicine and my approach to chronic disease and chronic health issues. So thanks again for joining me. So far, we've done a couple weeks on just an introduction to functional medicine. Last week, no, two weeks ago, I think we covered some labs for functional medicine. Today, I want to talk about food and the general approach to using food as medicine to assist your body's natural healing mechanisms. So I will reserve time for the end for questions. So if you have questions, let me know, and I will try to get to as many of them as I can at the end of the presentation. So we're kind of going to do a PowerPoint presentation style today. I'm not going to read verbatim everything that is on the slide. If you're interested, you can let us know, and maybe we can get you a copy of the PowerPoint presentation. If you would like to read it word for word. I'm certainly not. So my approach to diet when it comes to functional medicine is really to use diet as medicine. And given that chronic disease is mostly driven by inflammation, reactive oxygenated species, that's where we use food as medicine. We want to eat and consume an anti-inflammatory diet. And of course, that's a whole foods diet, nutrient dense, rich in fruits and vegetables, nuts and seeds, beans, legumes, healthy proteins with healthy fats, hopefully rich in omega-3s, rich in omega-7s, rich in omega-9s, and not all of the pro-inflammatory fats. So let me see if I can get the presentation pulled up here for us. There we go. So there are macronutrients and micronutrients. Micronutrients, of course, are mostly vitamins and minerals. The macronutrients, I include 4 macronutrients. So protein, fats, carbohydrates, and I include fiber because the standard American diet, the SAD diet, is typically horribly deficient in fiber. And fiber is so important for gut health. It's important to feed those good bacteria and create a healthy microbiome in the gut. So we'll walk through each of those macronutrients. And of course, if you're eating whole foods, nutrient-dense foods, chances are you're going to get the vitamins and minerals that you need. We'll go over some specific vitamins and minerals here in a bit, but let's start with meats. So there is definitely a difference between range-fed and cured and smoked meats. So a grass-fed animal, a grass-fed cow, for instance, has a dramatically different ratio of good essential omega-3 fatty acids compared to a feedlot cow, say, for instance, because a grass-fed cow is eating grass all day, and grass happens to be much higher in omega-3 fatty acids compared to the feed that cows consume at feedlots, typically grains that are high in omega-6. So we want, as often as we can, grass-fed, range-fed animals if we can. And certainly stay away from cured and smoked meats. Those are much more pro-inflammatory, and we want anti-inflammatory foods. Grass-fed cows, grass-fed beef is also high in a particular form of fatty acid called CLA, or conjugated linoleic acid, which is helpful not only as an anti-inflammatory agent, but it's very helpful for developing a healthy microbiome in the gut. There have been studies on grass-fed animals, and lot-fed animals are much higher in those pro-inflammatory agents, and there's a higher incidence in pediatric leukemia, for instance. And the ratios of omega-6 to omega-3 and monounsaturated fats, such as omega-7 and omega-9, found in olive oil, should be about 1 to 3. So one part ratio, 1 part omega-6 to 3 parts omega-3. Unfortunately, it's the reverse of that. In fact, it's more likely about 6 to 1, the ratio of 6 parts omega-6, which is pro-inflammatory, to only 1 part of omega-3, anti-inflammatory. So we should be consuming diets rich in omega-3. And from an evolutionary standpoint, that's mostly what we ate. There's also a problem with our sodium to potassium ratios. The current standard American diet, the SAD diet, has a sodium to potassium ratio of about 2 to 1, which is quite problematic for inflammation. It's quite problematic for blood pressure. It's quite problematic for all sorts of chronic disease. And the ratio should be about 1 to 10 to 50 parts potassium. Where do you get potassium, and where is all of this sodium coming from? The sodium is mostly coming from processed foods. So pizzas and hamburgers, restaurants use a ridiculous amount of sodium. Anything in a bag, box, or package is typically laced with sodium. So processed foods are high in sodium, and fruits and veggies are high in potassium. It's really quite simple. And so our ratios of sodium to potassium are certainly way off what they should be. And functional medicine doctors really do understand that most chronic disease may start in the gut. So it's important to identify and remove obstacles. What are obstacles? Foods that you shouldn't be eating, maybe foods that you're allergic to, maybe foods that you're sensitive to, and also foods that are pro-inflammatory, removing those from the diet. So if we don't understand that most health and most disease starts in the gut, then we're just trying to douse a fire with a little thimble of water, because we're just continually, perpetually consuming foods that are causing damage. You can think of it as holes in a boat, so paling water instead of fixing the root problem, which a lot of times I see patients, their diet is a problem of promoting inflammation, microclotting, and problematic for ROSs, which stands for reactive oxygenated species. And so we want to shy away from ROSs and pro-inflammatory foods. And there are both direct and indirect causes of ROSs. Direct, fats that have been processed, saturated fats, partially hydrogenated oils are problematic. And then any refined sugars, refined grains can promote ROS species in the gut and throughout the bloodstream. And there are also some indirect causes of increased ROSs in the bloodstream. Mitochondria, if your mitochondria are unhealthy, they produce ROSs. Immune system that is overexcited, they produce a lot of ROSs in the bloodstream. And there are certain foods that directly increase ROSs in the bloodstream as well, such as gluten, which is a protein found in wheat and some other grains, and then foods that are high in lectins as well. And I think I have a list of those here in a little bit. So again, if you have any questions, please let us know. So something was developed quite a while ago called the Dietary Inflammatory Index. So we know that diet is one of the main lifestyle factors which modulates the internal fires, the internal inflammatory process, and increase inflammatory markers in the blood like tumor necrosis factor, C-reactive protein. You can directly test for ROSs, uh, cell adhesion molecules, fibrinogen. So the higher the dietary inflammatory index, the worse that all of those inflammatory markers are going to be, and the more that they will contribute to uh, your chronic diseases. Let's see here. A question came in. I'm reading conflicting information. When trying to lose weight, are calories more important than the quality of food? That's kind of a big question. We'll maybe reserve a complete hour for weight loss. Calories are important. The timing at which you consume the calories are important. So intermittent fasting is getting a lot of press in the last 5, 6 years for its potential benefits, not only for weight loss but um, for improving brain fog, increasing energy levels. It can help with sleep. It can help lower blood pressure. It can help with a process called autophagy, which is your body's ability to identify and remove decaying or dying cells or infected cells from the body. So calories are important. Certainly, physical activity is important as well. A reduction in calories is important, although you do not have to go on a very low calorie diet. Uh, for most individuals, depending on your weight and your physical activity levels, that's going to fall into the range of, say, 1,500 to 2,000 calories a day. But quality of food is also important. If you're eating nutrient dense foods that are high in fiber, you will likely consume less calories because your appetite will be more sustained for longer periods of time. So, less caloric restriction is important as well. Let's see. Yep. So the dietary inflammatory index, it was scientists came up with it in the 1940s, actually, and went through a number of different food lists, proteins and fats and carbohydrates, processed and whole foods, and uh, they came up with a list. High on the dietary index are pro-inflammatory, and low on the dietary inflammatory index are anti-inflammatory. And of course, eating foods that are high on the dietary index, definitely we see a release of reactive oxygenated species, of pro-inflammatory cytokines, uh, interleukin 6, tumor necrosis factor, C-reactive protein, and then the anti-inflammatory cytokines are reduced. Let's see here. And we don't have time to get into all of the foods on the dietary inflammatory index, but you can look it up online. There are lists available. And we do know, um, after studying the dietary inflammatory index for decades, that a high dietary inflammatory index is associated with cardiovascular disease, cancer, heartburn or reflux, obesity, depression, uh, type 2 diabetes, poor vision, poor hearing, tinnitus, ringing in the ears, arthritis, metabolic syndrome, and overall mortality. So, if you're eating more pro inflammatory foods, you're more likely to die sooner than consuming a food that is anti inflammatory. And you can kind of see some of the studies that were done. We won't get into the details there. But there have been a number of studies, even followed up a couple of decades later, looking at individuals eating an anti inflammatory diet. They reduce their risk factors for a variety of chronic health diseases. Let's talk about fats. We know that fats have a powerful anti inflammatory effect. Um, And the fats not only have an anti-inflammatory effect, they promote the production internally of anti-inflammatory prostaglandins and cytokines. So not only are you getting the direct effect of anti-inflammatory fats, but the body appreciates that and begins to produce more anti-inflammatory chemicals and compounds in the body. So we want to shy away from the saturated fats and trans fats and partially hydrogenated oils. We want to focus on omega 3s, omega 7, and omega 9. Try to limit the amount of omega 6s because omega 6s are pro inflammatory. And I just listed a few there: avocado, macadamia, perilla oil. Certainly, cold water fatty fish are fantastic. Nuts and seeds of any kind are fantastic. Olive oil, the list goes on and on. Let's see. I'll address another question here. My issue is bread. My family traditionally eats a lot of bread. We're from Italy. Okay. And I recently saw Dr. Hader's Twitter post about homemade bread being superior to what we buy in the store. I agree with Dr. Hader. In what way does that matter from an anti-inflammatory point of view? Well, the main thing is that when you make bread at home, you get to control the ingredients. If you go to a grocery store and you pick up a loaf of bread, I challenge you to even pronounce the long list of ingredients that bread uh, is composed from. When you make your own bread, you get to control the ingredients. Now, does that mean that you're using a gluten-free flour as a base? Maybe. But if you're making your own bread and you have no gluten sensitivities, then you can use regular flour and the rest of the ingredients, all of which you can pronounce. And certainly you can add to it some anti-inflammatory agents as well. You can add anti-inflammatory oils. You can add flax seeds to your bread. So you can control the quality of your bread when you make it in your own home. Your house smells a lot better and it's tastier. So I do encourage you to make your own bread. Um, if you get a slightly fermented bread, like a sourdough, that's going to be slightly better for you than, say, a white bread. And certainly the more whole grains that you can incorporate, the more fiber that we can control in our bread. And again, most Americans are just deficient in fiber. So let's go on to sugars. Sugars we know have a direct inflammatory effect on the body. Refined sugars and refined sugars are found in almost all processed foods in bags and boxes and packages. And we know that sugars increase the internal production of cytokines and increases the production of pro-inflammatory markers like C-reactive protein, fibrinogen, and the list goes on and on. And there is a difference between a carbohydrate with fiber and a refined carbohydrate, a refined grain without fiber. Excuse me. And again, we're trying to get as much fiber as we can. I recommend to my patients trying to target somewhere between 30 to 45 grams of fiber every day. Now, you can keep a diet diary for a few days and kind of jot down all the foods that you're eating. If they're whole foods, you'll have to maybe Google, okay, I had a half a cup of broccoli. What kind of dose of fiber am I getting? But a target of fiber daily intake should be 30, 45 grams every single day. Sugars can also have resistant starches, which not only are deleterious to inflammation throughout the body, but the resistant starches actually harm your microbiome. So avoiding processed sugars as often as you can is recommended. And there's a great book. It was written back. It was written back in the 50s, I think, called Sugar Blues. If you've not heard of that book, if you've not read of that book, it's pretty remarkable that at least here in the United States, there is a linear relationship with Americans consuming more processed foods, particularly processed sugar foods, and the incidence of chronic disease. It's really remarkable. As the processed food increases, the incidence of cardiovascular disease and high blood pressure and diabetes, cancer, those all go up linearly with the consumption of sugar. It's a fascinating book and well researched. I encourage you to check it out. To gluten or to not gluten, I actually personally live in a gluten-free household, not because of me or my kids, but my wife has a gluten sensitivity. Anytime she has gluten, she breaks out in horrible hives throughout her body and has loose bowels and can suffer from migraines. She met me. I said, I think there might be something going on with your diet. And ever since she went gluten-free, she lives a happy, healthy, symptom-free life. So is everyone gluten sensitive? No. The research shows that maybe about 20–25% of Americans have a sensitivity to gluten. And if you do, you should remove it. It's not necessarily you will shed some weight if you're sensitive to gluten and you remove it from your diet, particularly in the first couple of weeks. You'll probably lose 5 or 10 pounds. Now, most of that's going to be some extra water weight that you're carrying around because of the consumption of gluten. But the removal of gluten isn't necessarily a weight loss program or protocol, but it can help you feel a whole lot better if you are gluten sensitive. We know that modern gluten containing staples like breads and pastries and pizzas has its own problems, but we know that gluten containing grains, they have high levels of ATIs, which stands for amylase trypsin inhibitors, that was as much as 100 times higher than most gluten-free foods. So processed or baked foods retain the amylase trypsin inhibitor, which means that you're not digesting the carbohydrates very well. You're going to have some resistant starches, which increases inflammation throughout the body. Most older wheat variants do have lower bioactivity than modern wheat. And most of Europe and other countries around the world use the older wheat variants and not the new genetically modified gluten and wheat that we grow here in the United States. Also, no Roundup is used in Europe, which is beneficial. And patients with celiac disease, which is gluten sensitivity and gluten intolerance, have a reduction in beneficial species of the microbiome. So gluten can actually start to kill off some of those healthy bacteria. And the dysbiosis actually improves when you remove gluten from the diet. So even if you're not gluten sensitive, there are reasons to consider removing or even just limiting the amount of gluten goes to. And one study showed that even in healthy individuals that do not have celiac disease, that when they're consuming gluten, you increase arterial stiffness, which of course increases blood pressure, homocysteine, which is a pro-inflammatory marker, ESR, or erythrocyte sedimentation rate, pro-inflammatory marker, C-reactive protein, insulin. Across the board, labs worsened when individuals consume gluten. So even if you're not one of those unlucky 25% of individuals that have a true gluten sensitivity or gluten allergy, removing gluten from your diet may be beneficial for you. Let's see here. Let me try to tackle another question here. Just wondering if one can do intermittent fasting with long COVID. Yes, absolutely. And I briefly mentioned earlier that performing intermittent fasting, whether it's on a 16 to 8 schedule or a 20 to 4 schedule or you fast for the full 24 hours, it improves a process that the body naturally does called autophagy. And autophagy is that process where the body naturally identifies struggling, decaying, dying, or infected cells and removes them from the body. So yes, it can be quite useful for long COVID. The key thing with intermittent fasting is pick the schedule that works for you. Again, if it's a 18 to 6 or 20 to 4, whatever schedule works for you. And that eating window, it's important not to overconsume calories during that eating window. But during the fasting time, that fasting time has to be a minimum of 14 hours. More likely 16, but it has to be a minimum of 14 hours for you to see those benefits of autophagy. In the framework that in the framework that a lot of medicines and also energy levels are low, is it something you recommend? It can actually boost energy levels, improve brain fog, decrease inflammation. When there's a longer window, when there's nothing in the digestive system that you're actively trying to break down, it can actually improve energy levels. The one thing I would caution is that fasting window, however long you choose, a minimum of 14 hours, you really can't cheat. You can't consume any calories of any type. So nothing in the system besides water, black coffee, unsweetened tea, herbal tea. Unfortunately, some toothpaste contain calories, some supplements, certainly gummies contain calories. So you can't consume any of that during the fasting window. And then some medications are actually coated with sugar. So be cautioned during that fasting window. You can look up online, whatever medication that you take, what the coating is. If it's a caloric coating, you're not going to see the full benefit of that autophagy as a long COVID patient. Lectins, a big topic. So lectins, you can think of them as like tenacious, sticky proteins that plants naturally use to protect themselves from pests, from insects. However, they're tenacious, they're sticky, so they can bind to cells in our gut, break apart the tight junctions, causing leaky gut and causing absorption of more things than you should be absorbing. And the border along the small intestine is where so much of your immune system is. And if leaky gut begins to happen, then the immune system gets overexcited and starts producing pro-inflammatory chemicals and cytokines. Let's see. I think that's in the way. Yeah. So foods high in lectins include most grains, nuts and seeds, unfortunately. Grains listed twice for some reason. Dairy and nightshades. Those are the most common sources of lectins. Let's see here. Let's go back to another question. I'm really worried about my kids' breakfast cereals. It's a nightmare to read all of the labels, agreed. And I feel they all have a ton of sugar. Most of them do, certainly. There are healthy choices, but most breakfast cereals are highly processed grains. They're actually heated up quite a bit to make those bran flakes or corn flakes or whatever. Certainly the cereals targeted towards kids are very high in sugar, and many of them have artificial sweeteners and artificial colors, and those aren't good for our kiddos. They all have a ton of sugar. Is there anything out there that is even remotely better? I like muesli. Muesli is a whole grain. You can make it yourself in a crock pot overnight. Oatmeal, steel cut oats is a great alternative. But most of the cold breakfast cereals are highly processed, contain resistant starches, and certainly added sugars and colors and all of that. I was horrified when I read an article, what is actually in our Cheerios. Yes, Cheerios are a highly processed. Um, there aren't any great options, but I get it. My kids like cereal too. I try to feed them. I try to look at the boxes, and the ones with the least amount of ingredients are the ones that they get to consume. But even with my kiddos, their breakfast tends to be yogurt, a lot of fruit for breakfast, oatmeal, muesli. So there are better options. They love eggs. Eggs are an excellent option if your kids like eggs, um, and they can have one or two eggs every day. Okay, let's go back here. Yeah, artificial sweeteners, preservatives, they have both direct and indirect effects on inflammation. Basically, if you read an ingredient and you don't recognize it, you can't pronounce it, um, uh, don't eat the food. It's in almost everything that's in a box or a bag or a package, and it's crucial that you read labels for anything that isn't a nutrient dense whole foods. Let's talk about age products. Not only can the foods be pro-inflammatory that we consume, but how we prepare the foods. You can take a perfectly healthy food, a whole food, and how you process and prepare it in your own kitchen can increase its dietary inflammatory index scale. So age products, age stands for advanced glycation end products, age products, and they do, in fact, hasten the aging process. So cooking, grilling, frying at high temperatures actually cross-links sugars and proteins. And when sugars and proteins are cross-linked, when you eat them, they start to aggravate, stimulate the immune system in your body, increasing pro-inflammatory cytokines, prostaglandins. And so cooking, grilling, frying at high temperatures, getting that nice, tasty browning going on your foods, that can be problematic. So try to cook low and slow and at lower temperatures when you can, so you don't destroy the healthful properties of the foods. So anti-inflammatory advice to consume good fats. Good fats include omega-3s found in olive oil, omega-9 contained in olive oil, found in fish and foods like nuts and seeds. Of course, I just told you that nuts and seeds have lectins, but if that's the only lectin source that you're eating, I think the pro or the anti-inflammatory fats probably outweigh the deleterious effects of the lectins. So an anti-inflammatory diet involves the intake of fruits and veggies, whole grains, recommended fruits and veggies that are higher on the ORAC scale, so antioxidant scale, include blackberries, strawberries, berries of all kinds, kiwi, peaches, mango. You read the list. Don't forget about beans and legumes. They're actually high in phytochemicals. The colors of beans and legumes and lentils, if they're black beans or white beans or kidney beans, those colors are actually antioxidant and anti-inflammatory. And then herbs and spices are very high on the ORAC score. So don't forget about that. Oh, I think I froze. Don't forget about that pantry that's full of oregano and rosemary and ginger and turmeric. Ginger and turmeric just happen to be some of the highest. And of course, getting plenty of fruits and veggies, nuts and seeds, beans, legumes, you're going to get those vitamins and minerals, the proanthocyanidins, to help inflammation stay at bay. Another question came in. What type of diet would help my brain fog dizziness associated with long COVID? You know, an anti-inflammatory diet, rich in fruits and veggies, nuts and seeds, beans, legumes, um, lean protein, healthy fats. If you haven't tried it, try intermittent fasting, because there are many reports of intermittent fasting improving brain fog and dizziness, particularly associated with long COVID. So give that a try. And what are examples of anti-inflammatory diets? So the Mediterranean diet, the Nordic diet, the DASH diet, the paleo diet. These are whole food, nutrient dense diets, um, associated with a lower consumption of processed meat, lower intake of sugar and sweetened foods and beverages and refined grains, and higher consumption of fruits, veggies, fiber, legumes, nuts and seeds, and seafood. And there are a few secret weapons you can add to your diet to really promote an anti-inflammatory effect of the diet. So probiotics and microbiome, 99% of your genome, 99% of your genome is non-human. You're actually more non-human than human, um, which just so surprised me when I first learned that 25 years ago, that I'm actually more non-human than human. So information processing uploaded to the cloud, you can think of it. So the microbiome is in control not only of producing some important vitamins and minerals, but it's in control of your immune system. And so much of your immune system is in the gut. So you can think of probiotics as kind of like uploading information to the cloud. When you have a better microbiome, your health is going to be better overall. Um, Oh yeah, we created this. So if you can scan this code, it'll take you directly to the functional medicine website. There's no cost for it. Just scan it with your phone, and it'll take you to our website. There are some probiotics that are better than others. I think I listed a few there. Um, you can think of the microbiome as an ecosystem, like a rainforest, and when you when you take away the rainforest, the rest of the world suffers. And so when you destroy your microbiome, your health will likely suffer. Bad bacteria love simple sugars and saturated fats, and good bacteria love fiber. So increase your fiber. Polyphenols can actually change bacterial behavior in your gut. So, what are polyphenols? Colors. I like to say, eat the rainbow, eat as many colors as you can. Challenge yourself to eat as many colors as you can every single day. Culinary herbs and spices are really secret weapons. They're very high on ORAC. So, anything in your spice rack it has some pretty potent anti inflammatory effects. Um, so, quantity matters. Overeating, you want to try to avoid overeating any meal a day. Pressure cooking is a great way to cook, or slow cooking with a slow cooker, because you're cooking at temperatures that do not destroy some of the beneficial effects. Both insoluble and soluble fiber are very important for health. I listed some sources of soluble fiber there for you. Let's see here. Here's another question, not directly related to diet, but we've got a few minutes. So, what's your best suggestion for the following 5 COVID shots: flu shot, shingles shot, a very strong, constant burning in the mouth, and loss of taste? It's very likely the COVID shots that is causing that burning in the mouth and loss of taste. Um, The underlying cause is inflammation, microclotting, probably some side effects of the COVID vaccinations. Um, Anti-inflammatory diet certainly recommended. There are functional lab tests that can be run to see what the level of inflammation is within the body. The place to start, if you just want to treat the symptom, which I never do, I treat people as whole systems, is zinc. Give zinc a try. The dose would be maybe 90 milligrams per day of the zinc. And then this is our last slide here. Optimal food pyramid. Ignore what the government's telling you. That's not the optimal food pyramid. Eat the rainbow, as many colors as you can. I actually recommend to my patients, my clients, to eat 9 servings of either fruits or vegetables, or both, a combination of fruits and vegetables. 9 servings, 5 colors every single day. You'll be getting plenty of fiber. You'll be getting plenty of those micronutrients, and you're going to help your microbiome a lot. Reduce your exposure to pesticides, to additives. Read those labels. See what's in there. Do not overconsume animal foods. I tend to recommend red meat no more than once a week, maybe twice a week. So really focus on lean meats, healthy fats. And the right fats, higher in omega-3, 7, and 9. And one of the first slides was about grass-fed beef. Make sure that your sodium to potassium ratios are correct. The potassium has to be more than the sodium. Definitely keep total sodium intake to less than 2 grams per day. And if you're eating all those fruits and veggies, nuts and seeds, beans, legumes, you'll be getting plenty of potassium. We talked about food additives, certainly reduce foodborne illnesses, and drink plenty of water. A lot of individuals are not as hydrated as they should. So that is just a quick example of the potential healing power of food and using food as medicine, and how I approach diet with my functional medicine patients. Let's see here. Just please explain what a serving is. That depends on the food. So a serving of broccoli is going to be different than a serving of lentils. Look it up online. Just keep a diet diary for a couple of days. I encourage everyone to keep a diet diary for a couple of days, maybe a couple of days during the week and then once on the weekend, because sometimes your diet can be different on the weekend. Write down everything you eat and the amount, the quantity of the actual food on your plate, the cooked food on your plate, or the raw food on your plate. And enter the food. There are tons of websites out there that you just enter broccoli, half a cup, and it will tell you what the serving size is and how many calories, how much fiber, how much vitamin C and A, and so on. So that was food. If you have a topic that you might be interested in for next week, please let us know. We will be back next week and continue our discussion about functional medicine. Again, check out our website. Make an appointment. If you've never seen a functional medicine doctor, you're missing out, because we can discover a lot more about your health and put you on the right path to hopefully optimal health and wellness, not just a resolution of symptoms that you might have. One more question, and then we'll be done. What is the correct amount of water you can take per day to be healthy? 2 liters enough? It depends on your size. It depends on if you're male or female. 2 to 3 liters should be adequate for most individuals. It depends on your size. It depends on male or female. It also depends on your physical activity level. So 2 to 3 liters per day is adequate for most people, just as a baseline hydration. Okay, so thank you all for joining me again. I will be back same time next Tuesday. So please come back and we'll have a tasty new topic for you. And if you have something that you want us to discuss, we certainly can. So drop us a line. See someone interested in fibromyalgia and chronic fatigue. Sure, we can do that next week if you'd like. So thank you, everyone. Enjoy your week. Thanks for joining us and take care.